Give us you're injured, you're misdiagnosed, dysfunctional, and in pain, because there are tools, assessment tests, treatment for specific conditions and injuries, and remedial exercises to stretch and strengthen that change people's lives. Hello, and welcome to Health Matters Seminars. I'm David Morin. I've been an approved provider of CE courses and have been teaching medical massage therapy since 2001. In over 35 years of practice, I've been honored to promote to the medical community and the general public the integration of highly skilled, clinically oriented massage therapists into the medical treatment and prevention of a wide range of physical injuries and conditions. As an instructor, my mission is to inspire you to join this quest, and I promise to provide you with all the tools you'll need to make it reality. The 3 videos in this series I'm sending you will only be available for a short time. I encourage you to watch them all to see how medical massage therapy can enhance the healthcare you deliver to your clients. In this first video, I'll share with you how our clothes-on, no-oil approach to medical massage therapy enhances mobility, resolves modesty issues, and brings a more clinical focus to your practice. And how eliminating draping opens up the all-important side-lying position so you can give your patients treatments such as they've never had before, further differentiating what you can deliver from the typical massage therapist. The quickest way to not go deep is to put oil on something and start gliding, because that takes more pressure to push down if it's gliding at the same time. So I found that if my client is wearing just a well-worn cotton shirt, cotton is like skin, and in fact has some traction to it, so that if I take a place and start to press, my finger doesn't slide and I can use less pressure through the clothing, and especially if I have a thumb saver, to deliver consistent, sustained pressure. The treatment is better than it was before. And so as I began to take that approach back to my practice, where it was mostly geriatrics, grandmother coming in her petticoat and her pantyhose and all that stuff, and takes 15 minutes to change between treatments, and then they're on the table, then they're cold, then you've got to get the room up to 80 degrees, and you're sitting there like this trying to deliver therapy with an 80-degree room. I'm sure you've been there. I know I have. And as I began to work clothes on, I was in a cold environment. And I would put the thermophore on there. I love to use the thermophore to warm them up. The moist heat pad, the electric moist heat pad by Battle Creek Equipment Company out of Battle Creek, Michigan. Wonderful product. I could use the thermophore on them. They were clothed. I could have them stand up and move around and see how a shoulder or a leg was doing after I treated it, see if they still had that pain as they took that step, and then back on the table, up and off, move over the table. Side-lying position has been more facilitated. So much ease of working with the person, and certainly takes care of those modesty issues. It's, after all, a rather intimate approach. There's not many medical professionals that treat anyone without someone else in the room, especially if it's an unclothed situation where they're examining a part of the body that has to be unclothed. And many, many people don't go to massage therapists because they don't want to get undressed. They may be rather large. They may just not want to be seen because they may not like their body. And I understand, of course, that many people want to take their clothes off and feel that gliding oil massage. And that's especially true in the relaxation, in the wellness massage area over here. Remember, I'm over here in the therapeutic, the rehabilitation, the consistently applied remedial work from injuries and conditions that have kept people from turning their head or raising their arm or able to get around. So that's what I'm dealing with, and that's what this program is all about, is to prepare people for those kinds of folks to come in. So the close-on approach has been really important, and it has opened up the very important, in my opinion, side-lying position. If we can put them in places where we can accurately and easily reach them with a push or a pull technique, then our hands are going to be better. How many times have you been out of position, leaning over, Poor body mechanics trying to get into an area that needs to be gotten into. The side-lying position takes care of that, and I'm sure you're aware of how difficult it is to maintain a drape in a drape position with the person in side-lying. So when they're clothed in side-lying, it just changes everything. I can then use pillows. In my clinic, I have a stack of 4 different pillows that I use under the head, under the knee, between the knees and under the feet to make them really comfortable in side-lying and therefore very approachable, meaning that in every course we'll do side-lying on the neck, the arm, the side, the hip, the leg, and it'll be fantastic to add to your program that you're already doing. Another benefit, of course, of the close-on approach is that it frees you from using oil or lotions. From a practical standpoint, to not have that continual cleanup, no mess, what a treat. The second video covers the importance of developing your understanding of human physiology and medical terminology. To give better treatments, for sure, but also because speaking that language allows you to work directly with and receive referrals from doctors and dentists, and to bill through insurance companies. In the third video, I'll share how my unique no thumbs, more pull, less push techniques allow you to extend your massage career beyond what your body would otherwise allow you to accomplish, which is particularly important for mature therapists and anyone planning to do massage over the long term. Using my hands and knowledge to help bring someone else out of pain and dysfunction, well, it just doesn't get any better than that. I've never dreamed that I would find one career that brought together all the aspects of what I've studied over the course of my life. I'm so surprised and thankful that this work that I love to do, developing and teaching these courses in medical massage therapy, draws on aspects of everything I've studied. I'm so grateful to have found medical massage therapy in particular, as it carries with it a complexity that keeps it all supremely interesting, and it's coupled with being of real service to others, relieving pain and dysfunction. It's wonderfully gratifying. It's all perfect and all worth it. I've been collecting skills and techniques for over 35 years, putting everything of worth that I could find into my tool bag. It's been my honor to have offered this package to thousands of students. And it's my fondest hope you'll pick and choose what works best for you and add those to your bag of tools so that you can successfully treat a variety of physical ailments that tend to stump other massage therapists. Thanks for watching. Look for more videos coming your way in a few days. By the way, if you found value in what I shared here with you today, please leave a comment down below. I'll read it and respond to you. And of course, a great way to share all this with your community is through Facebook. Please feel free to share the link to this video on your Facebook page or post it to a friend's or group page. Again, thanks for watching. I'm David Morin for Health Matters Seminars.